Yep.
Okay. What am I asking, of course? People my age that have trouble with this tech, not you, right? Okay, we'll also look at ionizing radiation. What's ionizing radiation? Ionizing radiation. I'm really quiet here. Anyone? Anyone?
Well, radiation usually makes an unstable like cell, like nucleus, protons, whatever. So if you have radiation, maybe it would make the cells unstable and damaged somehow.
Yeah, sure. Again, we're talking like chemotherapy or something, right? I mean, yeah, the whole point of it is to kill cells, right? Hopefully more cancer cells than normal cells, but that's kind of the point. Again, we'll talk about that a little bit. And nutritional imbalances. Okay, so obviously nutritional imbalances can cause damage to your cells. We'll talk about that later. Okay, so some of the things, one of the main ways to injure cells is through membrane defects. Okay, so if you think about that cell membrane and it gets damaged, all sorts of things can happen once you damage that cell membrane. Okay, what is that? That little thing in yellow? Calcium. Does anybody think it's weird that out of all the examples of things that can cause cell injury, we use calcium as an example, right? Have you ever heard of anybody overdosing from calcium? Pretty sure I never have. But in theory, it can, because when calcium gets in cells in too large of quantities, it activates all of these different enzymes, right? And enzymes eat things up, right? So in this case, you actually have an ATPase that calcium will activate to eat up ATP, right? And ATP is energy, right? So you can run low on energy. You can have these phospholipase eating up your phospholipid membrane, which is your cellular membrane in the first place, right? So if you damage a cell membrane enough where a bunch of calcium gets in, it can further damage the cell membrane, and now that phospholipase is actually outside that cell and starts damaging other cells, and you can see it be a chain reaction over and over again, right? Proteases, again, for proteins, right? They're eating proteins, and everything's like a protein. And, of course, endonuclease means it's damaging your DNA, right? So, again, calcium seems like a weird thing. This is a good example of something that you really never see, though in theory it could happen, but we have so many different protective mechanisms in our body, it usually doesn't, right? And if it does, it's at such a small level, most people would never even notice, okay? Questions on that? Okay. Okay, again, the depletion of ATP was one of those things that was in there. Obviously, if you have no energy, you can't do a lot of things. Now, do you guys have to know all of these little mechanisms and everything? No, you don't. Some of these will help you on your assignments, your homework assignments, because again, your homework assignments are pretty detailed, and I want a lot of detail in the physiology behind it, okay? So some of these will really help you on that, but these deep physiological processes you don't necessarily have to know for the test, okay? Because again, the tests are going to be more case study based. You should understand some of the concepts. Like you should understand, for example, that ischemia. What's ischemia, by the way?
Little oxygen. You're not getting enough of the oxygen, so your cells are slowly starting.
Yeah. So ischemia is kind of like hypoxia, right? Ischemia means you have decreased blood flow through a tissue, and since blood carries oxygen, it's also hypoxia, right? So anyway, so if you have ischemia, you have hypoxia, and then you're right back to that other slide, right? Less oxygen means less ATP because you can't do oxidative phosphorylation, okay? For $1 zillion, what the heck is oxidative phosphorylation? It's $1 zillion, man. Huh? Some of you guys have heard of it, I'm sure. And some of you guys have. It just really depends on some of the classes you may have taken. Some people go over oxidative phosphorylation. So odds are, a lot of you guys have heard of it, and you just don't remember that you heard of it because you're like, we did that process, but I don't remember what it's called. How about this? If you have one glucose molecule, how many ATPs can you make? Exactly, like 36, right? So that's the process where you had like one glucose molecule, and it goes through all these different changes, and then if you have oxygen, then it goes through this, pyruvate and Krebs cycle or TCA cycle and an electron transport chain and blah, 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 and you make all these ATPs, right? If you don't have oxygen, you don't make all those ATPs. Instead, you make like 4 ATPs by going through another pathway. Anybody know that other pathway? Okay, you end up with having lactic acid, right? You get like 4 ATPs and a bunch of lactic acid, right? Which is not ideal. That's how you end up sore, right? The next day, I'm sore because you have all the lactic acid in your muscles because you didn't have enough mitochondria, because you didn't train and make more mitochondria and that sort of thing, right? Anyway, so less oxygen, less ATP, things like your sodium pumps don't work. Okay, sodium pumps, there's a lot of different things that sodium pumps with, right? But probably the most familiar is that sodium-potassium pump, right? Where have you heard and talked about the sodium-potassium pump before?
Action potential.
Chemistry and action potential, right? So you've probably seen it in a couple different classes because it is really important. Okay, if your sodium-potassium pump is not working, there's a lot of metabolic things that aren't happening, like you can't contract muscles, right? Well, the heart's a muscle. That's not a good thing if you can't contract it, right? So again, you'll see these different pathways where if you don't have enough ATP, it's going to cause cell injury and or possibly death, and possibly on a macro level, things like heart attacks and of course can cause a whole person to die, right? Any questions on any of that? Okay. In case you were wondering, this is how that increased calcium inside of a cell destroys everything and activates all those enzymes. Probably makes no sense to most of you guys, that's fine. It's just a bunch of second messengers and pathways that get activated to do all these weird things, right? It's a lot of biochem right there. Okay, what's a free radical? Yes?
I don't know exactly, but it has to deal with electrons.
Okay.
That's what I look at.
Yes, it does have to do with electrons. Free radical. Here's how I explain it. Okay, it says it is it's highly reactive and it disrupts pathways. Okay. Everybody stand up for a second. Gotta stand up anyway, right? Okay. So a free radical is kind of like this. Say I went around the room and I took like every third chair, right? And then I threw them in the hallway. And then I said, okay, on the count of 3, everybody who has a chair gets an A, everybody else fails. Right? What would happen? You freak out, okay. What else?
Try to go run to get the chair.
You go run to get the chair. Fine. Okay, and that's kind of what it happens, right? Some people won't want to run to get the chair, right? Instead, they just beat up the little person next to them and take it, right? Anyway, you guys sit down. That's kind of what a free radical is, okay? Free radicals, they are, like they say, highly reactive, as in, I'm going to go run and get a new electron from somebody. So they will steal it from the atom next to them, which means that the atom next to them will try to steal it from the atom next to that. While they're doing this, they're bouncing off. Electrons move really fast, if you didn't know that. They're bouncing all over the place. They're trying to steal and restabilize themselves, and while they're doing it, they're tearing up cell membranes. And as we saw a few minutes ago, if you tear up cell membranes, the cell can be injured or die. That's what free radicals do, is they cause rapid aging if you have too many free radicals in your body. Okay? Now, all free radicals, by the way, aren't necessarily bad. We actually do have some mechanisms in our immune system that make free radicals to kill off things like bacteria. But in this case, we're talking about a lot of free radicals that are running rampant in the body, and they're destroying cells, right? This is what's causing aging. If you look at this list over here of free radical things that cause free radicals, you'll see some of these things on there, like smoking, for example. Okay, there's like what 4,000 something different chemicals in cigarettes. Okay, I don't know which ones particularly, because there's 4,000 of them. Combinations of those, they cause people to age faster. Did you ever notice that? Have you ever seen anybody like compare a 40-year-old that never smoked compared to a 40-year-old that smoked like for 25 years?
Yeah.
Right? That person that smoked for 25 years usually looks a lot older than the other one, right? That's because they're constantly making free radicals, constantly damaging cells, constantly having to regenerate them. But as you get older and they regenerate slower, you tend to start seeing wrinkles a lot faster and more often. They can't really get rid of them as easy, and you start like aging, right? Sure, there are some people out there that, you know, they just have really good genetics, and it doesn't matter what they're gonna do, they're fine, they're gonna have perfect skin their whole life, and that sort of thing, but it's not what we're talking about, okay? Also, you know, living in really big polluted cities will age people faster. Chronic inflammation creates free radicals, ages people faster. Here's the ones you guys gotta worry about, right? UV light. Because right now you're all young and your skin's all supple and moist, and you go ahead and you lay out there and you get tans and you look awesome because you're all golden bronze, and you know what? Try that when you're 45 and you're gonna look like a prune, right? And again, you see that sometimes. You see this like sometimes like Hollywood actors that choose not to get a whole lot of surgery, right? They look old really fast. I don't know how old Tommy Lee Jones is, but he looks like he's 120, right? That might have been from a lot of this kind of stuff in his life. I don't know. Questions on free radicals? Does that make sense what they are? Yes?
What about like oxygen-free radicals? What are the differences between those and like the free radicals you're talking about?
Well, a lot of these are oxygen-free radicals I'm talking about, but you're talking about like the oxidative burst that causes free radicals. Is that what you're talking about?
I used to
Reactive oxygen
I
species?
did volunteer work with the EMTs, and we were told that if a person's having at 100%, you're not supposed to keep giving them oxygen because it can create oxygen-free radicals.
Yeah, it's the same thing.
So that's that.
Yeah. There's other reasons for that too, by the way. If you find somebody that's like a chronic smoker and you set them 100% oxygen, well, the problem is after you're a chronic smoker for a long, long time, your body gets used to having increased CO2 levels, and that's controlled by your brainstem. And if you give somebody too much oxygen, when they're used to having a lot less oxygen, it can freak their brainstem out, and it can actually make them stop breathing. So that's another reason why EMTs shouldn't do that. And they usually don't. I mean, EMTs are trained really well for not killing people, right? Okay. So again, this is the hypoxia. I think we covered pretty much everything on the slide already, other than why, right? Again, this is applied pathophysiology, which means we need to apply it. Why do we care about all this stuff I was talking about? Well, this is why we care. Internal enzymes can be measured in lab tests. Okay? What does that mean? That means that, in theory, if you have a cell, there are enzymes inside that cell that should not leave that cell in any massive amounts, right? If, in fact, they do bust out of that cell, they end up where? In the bloodstream. Therefore, we can stick a needle in the bloodstream, pull out a blood sample, and if we find certain enzymes, we know that there's something wrong in that place. Can anybody think of an example of where that might happen? Where we can do a blood sample, find some enzymes, and go, oh, you have problems with?
Insulin, like blood glucose?
Those are hormones we're talking about. Well, and carbohydrates, of course, but yeah, insulin's like a hormone. That wasn't exactly what I'm talking about. Anybody?
Does that have to do with like different organs have different enzymes? So
Yeah,
your
different organs have
liver
different
or
enzymes.
Kidneys could be releasing different enzymes.
Sure. Some of the classic ones that we usually talk about are like the liver, for example, right? The liver has specific enzymes like AST and ALT, okay? You find a bunch of AST and ALT in somebody's blood sample, you're like, you have liver problems. Why? Because you really don't find that anywhere else, okay? And if you find that AST and ALT in somebody's blood sample, you can say, yeah, you have liver issues, right? Usually people like chronic alcoholics or somebody with hepatitis, right, will have liver damage. And then you can find those enzymes, right? Pancreas has some specific enzymes, like what? Lipase and amylase, right? Again, that's a very good indicator you have pancreatic issues if you find those. The heart has some specific enzymes. Anybody happen to know? We'll get there eventually, but one enzyme, for example, that's very specific to the heart are the troponins, okay? So if you find troponin I or troponin T, for example, in your blood, you can say, those should have been in your heart muscle. What are they doing in your bloodstream? Something must have burst. You must have destroyed some cells in your heart, which means, by definition, you kind of had a heart attack, right? And we've been doing this long enough where we can actually, have you ever heard of anybody like going to a hospital and then the doctor would be like, you know, you had a heart attack like 4 days ago. Ever hear of that? That's how they know. They'll go ahead and they'll pull the troponins and, you know, we have standards, you know, and you can see, you know, this is how many you have, which means you probably had a heart attack this long ago because you know that that's the only place it can be coming from, right? So that's how we use them clinically. It's all about physiology and understanding the physiology, and then we can make assumptions based on that, and we're usually right. That make sense? Okay. So there's a purpose to this madness, in case you were wondering. Okay. You know the bad part about getting rid of my phone is I can't use it for the iPhone is deaf. Anybody want to explain what atrophy is? Yes?
It's where it decreases in size.
It decreases in size. Cells shrink, right? What's an example of atrophy in the body?
People who become in wheelchairs or leg muscles naturally become atrophied.
Perfect. You didn't have the picture on your slides, did you? Right? So those legs are clearly atrophied, right? The cells themselves shrink in size, therefore the entire muscles shrink in size because maybe they were in a wheelchair for a long time, right? And you guys ever like broke an arm and then have to cast off like 3 months later and you're like, I got a mini arm, right? And eventually it reverses, right? It eventually catches up. So atrophy, it can be, absolutely can be reversible. Most of the time it probably is. Yeah? How about hypertrophy? Hypertrophy. Increase in the size of cells. Exactly. An example of hypertrophic cells. Where would you see this? Like the liver?
Yeah.
Sometimes you do have really big livers. Most of the time, that's not because, well, yeah, it is. I was thinking muscle, but yeah, you would like increase like fat cells, size of fat cells in the liver, and that could cause a really big increased liver too. Yeah. Worked out. That's the whole point of lifting weights, right? Is you hypertrophy them, you hypertrophy them. You don't make more cells, you just make them bigger, right? When is a bad time to have hypertrophy? What don't you want big? Liver is one.
Your heart.
Your heart, right? Typically, we're talking about the left side of the heart. So you have a hypertrophic left ventricle. Why would you have a hypertrophic left ventricle? How are you working that out?
Powerlifting.
What?
Powerlifting.
Powerlifting?
puts a lot of strain on your heart, so your heart is just contracting really hard. So when you power lift, the walls of your muscles, the cardio muscles get stronger, which makes the arteries smaller.
That is probably true.
Have a heart attack.
I did not know that. I assumed that the power lifters were having heart attacks and hypertrophic hearts because they were taking steroids, which would do that. But I guess in theory, if you're constantly powerlifting, it would do the same thing. Anything you do to raise your blood pressure, long-term, chronically, will cause cardiac hypertrophy, right? And notice the size of the space that you put blood in, the lumen, on the right side versus the left side, right? Because when you make that heart big, it goes both ways. And now you have a lot less blood that'll go through there. Yes?
So like if you have a really large heart or something, like you have like really bad hypertension or whatever, like the medicine that doctors prescribe, can it shrink your heart back to normal size, or like does it have any effect?
Is it reversible? In a lot of cases, it can be reversible. Just like me, when I was your age, I had big muscles and then it all reversed. Very sad. Actually, I moved all that stuff from up here and moved it down. That's a different story. Okay, hyperplasia is different than hypertrophy because yeah, you're making more, right? Okay, what's a normal hyperplastic process? A normal process in the body that you go through that you are supposed to make more cells. Growing when you're really tiny, sure.
Osteocytes? Make more bone cells?
Make more bone cells. Yeah, I suppose, but that's also part of growing. Once you're an adult size, you really don't make more bone cells. You take things out and put them back, you know, as far as calcium and structure goes constantly. Don't know if you're necessarily making, I guess you are, at a cellular level you are, because your osteoclasts are breaking down bone and osteoblasts are rebuilding. So yeah, I guess so. A classic example of hyperplasia is like your endometrial lining. Is that what you're gonna say? Right? Not your endometrial lining, because you're a guy. But endometrial lining of the uterus, again, every month, right? You actually lose cells in menses, and then you have to make more in that functional layer of the endometrium. Right? So that's normal. What would be abnormal? Like a tumor. Yeah, absolutely. That would not be good. That's abnormal. Hyperplasia, making more cells. By the way, as a side note, when people get when people get fat, is that hypertrophy or hyperplasia?
Hypertrophy and then hyperplasia is because you increase the amount of adipocytes in your body, but then you also can increase the size of the cells too.
Okay. Yeah. Typically, as an adult, your fat cells get bigger. They go through hypertrophy. You gotta be really, really, really big to go through hyperplasia as an adult. I mean, huge, right? Now, having said that, guess who goes through hyperplasia with fat cells easily? Little ones. Like up to you're like 6 or 8 years old, somewhere in there, your body will go through hyperplasia with fat cells fairly easily if you are an obese little kid. That's the problem, because we're seeing a lot of that lately, right? That's why they're saying this is the first generation that their parents may outlive them, because we're seeing a lot of very small children being obese. Preferentially, they actually go through hyperplasia, make more fat cells, and then when they hit their middle ages, when people tend to put on weight, now they have a lot more fat cells that can get big individually, and then they get really, really big, and then they can even do more hyperplasia, right? So that's one of the problems, is, you know, we're seeing a lot more of that lately. Yeah?
So you said for adults, which one, for children using hyperplasia is more common, but for adults that are...
Well, they go through both,
they don't,
but...
What's the other word? Sorry, I don't know.
Hypertrophy?
Hypertrophy, okay.
Yeah. So adults preferentially will do hypertrophy first with the fat cells. Kids under like 6 or 8 will hyperplasia first, and then they'll go through hypertrophy. Okay. What about metaplasia? What's that? What's the key in metaplasia? It's reversible. Perfect. Right? So you have metaplastic cells that, again, it's a mature cell type. Okay, so maybe it's cuboidal and it turns into columnar, or maybe it's stratified squamous epithelium and it turns into columnar or something like that, right? These are usually protective factors. Okay, like for example, you know, if you constantly have acid reflux, acid's coming up into your throat out of your stomach, right? And normally this is what we have. We have these stratified squamous epithelium in our esophagus, because why? You got a whole bunch of little thin layers, and you can like swallow a potato chip, and it's okay if it rips a few layers off. It hurts, but it's okay, right? They'll grow back. There's a bunch of them. They're not really made for acid, though. Okay, if you see in the stomach, though, you get those long columnar cells. They're made for acid, right? The acid really can't get all the way to the basement membrane and start eating through things. So what will happen is if you constantly have acid reflux over a long period of time, you'll actually change cell type. Still, they're both real cells. They're both mature cells. It's just that you change one to another that's more protective. If you solve the acid problem, they'll go back to what they were before. Okay, so that's metaplasia. It changes from one mature thing to the next. Okay. Dysplasia. Good or bad? Bad, right? Every time you hear dys, it's bad, right? So dysplasia, now we're talking about some kind of unrecognizable cells. It went through a dysplastic change. Usually we're talking about like cancer or something, right? It just created something that shouldn't exist in the first place, okay? That is rarely reversible once you call it a dysplastic cell. Questions on that? Okay. Again, you can see this, you know, may or may not recognize it, but this is normal over here. Obviously, something going through that basement membrane and leaking into the body, that's not good. Okay, you don't have to be a pathologist to figure that out. Yeah?
So skin cancer is going to be considered more dysplasia than metaplasia?
Yeah, skin cancer. Yeah, if you are calling it skin cancer, it is dysplastic at that point.
Okay.
Yeah, there's some, you know, other things that we call pre-skin cancer, and that could absolutely be metaplastic, but sure. Okay. I can't remember why I put this slide in here. The mechanical forces, obviously, you break things, and it breaks cells, right? Kind of like that runner thing, you know.
I found it.
Oh, what's it called?
It's actually, it's talking about iron intake, and it says athletes engaged in endurance sports such as long distance running may also have an increased dietary iron requirements, increased blood loss in feces and urine, and or chronic rupture of red blood cells caused by the impact of running on hard surfaces may be why endurance athletes have increased iron requirements.
That's interesting. Doesn't really have a name though, that's why you couldn't remember the name.
Yeah.
Okay. Cool. Hey, thanks for reading the book.
Is that nutrition?
It's nutrition.
Oh.
At least
Okay. Thanks for reading a book. All right. All right. I can't remember why I made this slide. This is kind of interesting. Okay, again, like I said before, if you have a massive voltage going through your body and blows out a bunch of, obviously that kills cells, right? What we're talking about here is like an electrical shock that will make somebody very, very tired, but it really didn't cause any permanent tissue damage, okay? So I have a good story about this. See, what's happening here is you have cell membranes, right? And you know about the electrochemical gradient, right? On the outside and inside of cell. You've seen that in previous classes, right? Well, if you run an electric volt through that thing, it's going to just throw all those off, right? It's going to throw all your electricity off on the outside and inside of your cell membrane, which means now anything can do whatever it wants. It can seep through, in and out, whatever. It throws off all of those ions, you know, anarchy, right? Everything needs to be reset. Okay, well, how do you reset them? You got to pump stuff back where they belong, right? And we need ATP for that, like that sodium potassium pump, right? So you have to reset a whole bunch of cells all at the same time. If you had like electricity go through a huge part of your body, okay? That takes a lot of ATP, which means you run low on ATP, which means you get really tired, okay? Out of energy, literally. So my story on this is, so there I was, minding my own business. I'm like 16, right? And I'm mowing the lawn. And remember, I still see this in my head, right? One of those traumatic events of childhood. So I'm mowing the lawn, that wasn't a traumatic part. And my dad is like sitting in the driveway, he's like under the car because he's fixing something. He's always fixing something under a car. But I get done mowing the lawn, and I look at that little bar, it's still on, I had a little thing, tried to turn it off, wouldn't turn off. Okay, so I can't get the lawnmower to turn off, right? The switchy thing's broken. So I'm like, okay, I guess I'll pull the spark plug out, right? So I have my hand on that metal bar, and I reach down and pull that spark plug. And unfortunately, I did actually pull it off the wire, off the spark plug, but I'm still holding this metal bar, and now I'm holding a wire, and it's like a direct conduit right through my body. So the electricity is just going straight through my body, and you know, and the motor is winding down, but it takes a while because like, the whole time I'm like, ah! Like that. You know, my dad looks up from the car and he's like, looks like I'm crazy, right? And I'm sitting there just hanging on because you can't let go. If you've ever been electrified, you can't let go, right? I'm like grounded, like ah! And then the lawnmower's winding down, and eventually I can pull my hand up, right? I hate electricity, by the way. And I remember I was really tired the rest of that day. Now, I didn't know why at the time, because I was 16. But when I found out how this works, again, this is not like getting hose blown through you kind of electricity, but that's what it did. It like went from here all the way through here and all the way through, right? That's a lot of tissue and a lot of cells to have to restabilize those electrochemical gradients. That took a lot of ATP to do that. I don't remember having any burns or anything on my fingers or anything like that. But I do remember being very, very tired. Why? Probably because that went right through my chest, which means it probably focused all of that ATP that I did have to make sure my heart was doing okay. And then maybe kind of worked its way out or something like that. But that's how I would have, I don't think I did, but that's how I would have had like a little burn or something on fingertips or something, right? Is because that would be like last priority. And if you ran out of ATP before that, you go, well, I guess that tissue dies, right? So I think it's kind of interesting. Apparently I'm the only one. Yeah.
So correct me if I'm wrong, but I heard that electrical burns or getting electrocuted sometimes that will stay in your body if it's not, goes from one point to another.
Mm-hmm.
Is that possible? That like you could have electricity in your body for longer than just like the time you're electrocuted for?
It's got to go somewhere. I would imagine it would dissipate. That probably has a lot to do with how much electricity, but I guess. I mean, you're not making like a superhero, I know that. Where you just walk around. I mean, that's what static electricity is, right? Electricity builds up in your body and you touch something, right? So, I mean, you can keep electricity in your body. How much? But this probably would have been better at the beginning. Yeah?
Sorry, this is a little bit back, but how would like an electrical shock like that not mess with how your heart beats? Like the electrical current of your heart, it's strong enough, wouldn't it mess that up too?
You would think. And if I did that today, I'd probably lay in that driveway.
Yeah.
But like I said, I was 16. At 16, I was, a cross-country team. I was running a 434 mile. I mean,
Yeah.
I was in really good
a
shape.
strong enough heart
Yeah.
to take that.
Yeah, it'd probably kill me nowadays. But yeah. I know you wouldn't know if I knew now. Right? Okay. So again, that's the same thing, just a little bit closer. I don't know why I put these way back here, they got lost. Okay, nutritional imbalances. Obviously, nutritional imbalances can cause some pathology, right? They can destroy cells. Who knows what atherosclerosis is? Arteriosclerosis technically is hardening of your arteries. Atherosclerosis is a subcategory of arteriosclerosis. So yes, you do have hardened arteries with arteriosclerosis because it's a subcategory. With atherosclerosis because it's a subcategory of arteriosclerosis. But what else about it? Atherosclerosis. Atherosclerotic plaques. That's what we're looking at right here. What is that? That's like cholesterol buildup, right? So yeah, you do tend to have hardened arteries, and then at the same time, really, you start building up cholesterol in your arteries, right? Well, if you build up cholesterol in your arteries, of course, you don't have as much space for blood to flow through, so blood flow slows down. We have arteries all over the place. A lot of times it's not a big deal, we won't really even notice it. However, if these arteries happen to be, I don't know, say your heart, right? That's kind of a problem because your heart doesn't go through anaerobic respiration, right? You're not making lactic acid in your heart, it just doesn't do it. You run out of blood flow and therefore run out of oxygen in your heart, it's going to die, right? That's that whole hypoxia thing. Okay? I think it's still the #1 cause of death in the U.S. Although I want to say I heard recently that something else took over, but I don't know. What about type 2 diabetes? How does that cause cell injury and or death?
Well, with type 2 diabetes, you have more sugar intake than your body can use. So maybe it causes imbalance of the sugars in your body, or too much of it, which kills the cells.
It does. Yes.
I was gonna say that if you have an overload of glucose, your pancreas won't be able to handle it, and then that also makes your pancreas weaker, so it won't be able to balance out the acidic food from your stomach when it goes into your small intestine, so it'll be messing up your digestive tract on the lower region as well. So you won't be able to absorb nutrients, so you also have a deficiency in the long run.
That is possible that it would cause pancreatic issues and mess with those digestive enzymes. I guess that's theoretically possible. I'm not sure if I've ever heard that or not. The main thing we're usually talking about with diabetes, kind of like what you're saying, is sugar is stuff, right? Sugar does tend to mess with water, draw water to it, just like anything in your bloodstream draws water to it. If you have massive amounts of sugar, you are going to throw off your water balances in your body. And if you do that over a long period of time, sugar will also eat away at the arteries, especially away in the periphery, your fingers and toes. So diabetes, especially diabetes type 2, because it's more common, will actually cause your cell death way at the peripheries of your body, because that large amounts of sugar over a very long period of time will cause that. I believe, actually most of this stuff is in your homework assignments. It's probably a little more detailed explanation somewhere about exactly how that does that.
That way you also might get edema with type 2 diabetes and that.
Yeah, but also because it kind of kills your kidney too. Again, your kidney, the amount of insulin you have can't possibly store all of that after a while. And so you just have massive amounts of sugar going through those filters, and it can destroy your kidney too. And of course, cancer. Of course, that can kill cells. It takes over. You know, the mechanism makes its own cells, crowds out good cells, so that they can't do what they need to do. And then, of course, there's a whole lot of problems with deficiency, right? Your runner iron thing, right? So all these things. Okay. Okay, what I need you to know about these various types of necrosis, if you gotta go, just go. What I need you to know about these various types of necrosis is pretty much just a couple things, right? What it looks like, where is it usually found? Okay, I think your homework assignment also has given an example of something that would cause it. Okay, so for example, coagulative necrosis. Okay, found in a lot of different places, but we want to remember like kidney, because that's like the most common. So you find coagulative necrosis like in the kidney, it looks like a gel. Okay, your cells just start dying, and it looks like a gel. Okay, here's like a gross specimen of a kidney that had some coagulative necrosis, like it's kind of gelled up. Okay, liquefactive. Think brain. Okay, what happens is sometimes you'll have some invaded pathogens, like some kind of weird worm that you get from, or a parasite that you get from undercooked pork, that'll go into the brain, and then the brain will kind of detect that and make a shell around it, like out of calcium, and it like takes that little worm and puts it in a shell, and then liquefies everything inside it. Okay? So if you think about liquefactive necrosis, yeah, it does happen other places. The brain is a really big one. Okay, so it would do that with, like I said, that little worm. It also do it like in syphilis, kind of liquefies your brain. Obviously, that part of the brain that liquefied, it's done, right? You're not getting that back. It's just dead, liquefied, not coming back. Okay. Think about when you hear caseous necrosis. Any ideas? Okay, first think cheese, because casein is a cheese protein. Caseous necrosis is like cottage cheese-like. It's actually a combination of coagulative and liquefactive, so it makes like this cottage cheesy-like necrosis. And think tuberculosis in the lungs, for example. TB can go a lot of places, but obviously it starts in the lungs. Think about that again. It's the same kind of thing in the brain, where TB will be walled off a lot of times and make this little shell around it, and then it kind of liquefies / coagulates and makes this cottage cheesy like inclusion inside of the shell. Okay. Fat necrosis, obviously places that are fat. Lipases, right? Enzymes that can eat fat. Sometimes you get autodigestion of fat tissue. That's a good example of that. And then, of course, gangrenous necrosis. That's what you're talking about earlier a little bit, right? Where do you see this mostly? Yeah, usually the extremities, right? Feet, hands, usually diabetes. Frostbite can cause this, sure, because what's really happening is the tissue's dying, and then it's being invaded by some very powerful bacteria, which is causing gangrene, which is this tissue necrosis, this death that kind of spreads and works its way up. Okay, you know, this foot actually looks like, it's not. I didn't take a picture because I don't think I was allowed to ethically, but that was actually the very first surgery that I ever did when I was in med school. I think I was a 4th year student. So I'm in this hospital, and I get called into the operator. I'm like, yes, right? My first surgery, I go in there, and there's a resident, you know, and me, and then there's like, you know, scrub nurse and the instrument people and all that. Anesthesiologist, of course. This guy's knocked out on the table. And I go in there, and my job is to hold this foot. It looked like that. Oh my gosh, did it smell? Just horrible. So I'm actually holding it like this, right? I'm holding his foot. And that resident, he pulls out this little saw. It's like, it looked like my dad's skill saw, electric saw, but it's like this big, and it was like chrome. It was beautiful. It was like a chrome saw, probably cost 10 grand, I don't know. But he pulls that out, he's got a cauterizer in one hand, saw in the other, and he's like, next thing you know, I'm holding a stump, right? A little bit of an ankle and a foot. It was, oh my gosh, if it didn't stink bad enough before, now you cut it off, whoa, powerful, powerful smell right there. And, we bandage him up and everything, send him back to the floor. This was like my first week of surgery rotation, which is like 16 weeks, right? So again, being the med student, I got to go around, and treat his bandages and keep them all clean and everything and that sort of thing. Well, I noticed that it didn't stop. We didn't cut him up high enough the first time. So we take him back in there, chop him off right above the knee, right? Oh my gosh, he was mad, right? So I'm doing the rounds and everything, he's mad. Who is that doctor to cut my leg off and everything? I came in here because I don't remember why. It's some stupid reason. He actually didn't come in for a split, I don't think. But they're cutting my leg off. Guess what? 2 weeks after that, took him off right at the hip because it kept going, and we were like, okay, we gotta be sure this time. It just took him right off there. Oh my gosh, he was livid at us. The reality is diabetes type 2 causes this, and diabetes type 2 doesn't cause this. Untreated diabetes causes this, right? And it takes like 5 to 10 years to cause these kind of problems. Okay, so these are people that I'm sure you know them, have diabetes, and they're like, it doesn't hurt, and it doesn't hurt. You actually don't feel much different at all when you have really, really high blood sugar. Kind of get used to it. It's not really a big deal. You don't really notice. So they think it's not a big deal, but you probably know somebody who's in that category, or maybe not, but you need to tell them, you need to treat this every day. You need to change your lifestyle unless you want to start cutting off pieces. Because, again, it's usually middle-aged men. They're like, it's not worth it, I'm fine. Yeah, but you're not going to feel that way when you start chopping pieces off, right? So that's gangrene, or gangrenous necrosis. That's a pretty figure right there. People tend to take that a little more seriously once that happens. Okay. Again, these are just some slides and real specimens of different kinds of necrosis. Oh, are you taking a picture of it?
Yeah.
Okay. And that's it. Anybody have any questions about any of this? Comments? Thanks. You can stop recording.